Good afternoon. Welcome to the Lynn Cancer Institute, where we're trying to keep you in the know in 2024. As part of our Lynn Cancer Institute Survivorship series, today our presentation will be entitled Moving Forward After Cancer Treatment: Important Guidelines for your quality of life. We're very grateful to have you all with us today and to learn from one of our Gloria Drummond physical therapists, Ruth Light. At the Lynn Cancer Institute, we believe that education, prevention, screening and early detection, a variety of treatment options, the expertise of our staff, and our latest technology will truly save lives. In the interest of time, Ruth's bio was sent to you by email. We invite you to please take notes during this presentation, and if you have a question, please put it in the chat box or in the Q&A box, and Ruth will have time at the end of her presentation to answer any of your questions. Thank you all, and we're happy again to welcome you and to introduce Ruth Light. Ruth?
Hi, everybody. Hopefully you can all hear me. So our topic today as part of the Survivorship series is moving forward after cancer treatment, important guidelines for your quality of life. We're not discussing any specific type of cancer diagnosis, so it will be an overall view of what to do after you're finished your cancer treatment. As you know, my name is Ruth Light. I'm a physical therapist over here at Gloria Drummond Rehab. I'm a PORI certified oncology rehab specialist. PORI is the Physiological Oncology Rehab Institute, and I'm also a certified lymphedema physical therapist. Okay, so according to the American Association for Cancer Research, unprecedented advances in cancer treatments over the past decade have led to more patients living longer and fuller lives after a cancer diagnosis. As of 2022, there were 18.1 million people living with a history of a cancer diagnosis, and this is equal to about 5% of the US population. And this is quite a large improvement from about 50 years ago when cancer survivors constituted only 1.4% of the US population. And the number of survivors is expected to grow to 26 million by the year 2040. So what do we mean when we say survivorship? A person is considered a cancer survivor from the time of diagnosis through the balance of life. There are many types of survivors, including those that are living with cancer and those that are free of cancer, and some that are continuing on longer-term medications that they continue for a number of years or ongoing after their treatment. So cancer treatment. Cancer treatment can be comprised of any or all of the following: surgery, chemotherapy, radiation therapy, immunotherapy or targeted therapy. And as I said, it can be some, all, or any combination of these. So the question we have for us today is, you have finished your cancer treatment, now what? What is the plan for you moving forward? And I just want to mention that you're going to see that most of the guidelines that I'm going to bring up really apply to everybody, not just people that have survived cancer, but there are specific studies and benefits for these that have been done specifically with cancer survivors. So we can all really learn from a lot of this. So some factors to consider for quality of life, and these are the things I'm going to touch upon today: diet and nutrition, sleep, emotional and psychological wellness, and exercise. Now, as you all know, I'm a physical therapist, so I would say that the bulk of our conversation today will be more about exercise, but I am going to give some information on the other items as well. So first off, diet and nutrition. So according to the American Association for Cancer Research, consuming a healthy diet that incorporates whole grains, fruits, and vegetables can increase survival from cancer and reduce the risk of cancer recurrence. And it has been reported that eating a healthy diet can lower cancer-specific mortality by 14% when they looked at it globally. Plant-based diets, Mediterranean diets, and other similar ones have been associated with reduced overall mortality in cancer survivors. And people that partake in highly processed foods, red meat, sugar, and alcohol had patient-reported poorer quality of life. So emphasizing a healthier diet can help improve quality of life, reduce side effects, and decrease mortality in cancer patients and survivors. So as I said in the beginning, these are all guidelines that really all of us should try to follow, but there are specific studies with these with cancer survivors. And of course, we all are not perfect all the time, and so you need to live your life. But if the bulk of the time you're following these guidelines, you're in a pretty good spot. So what can you do? You can speak to your doctor. You can get a referral to dietitians and nutritionists. We have those over at Lynn Cancer or out in the community. And there's lots of online resources as well. And that'll be a running theme. There's so much online that can help you in a lot of these things we're going to talk about today. So next up, we're going to talk about sleep. So you might say, why are we talking about sleep in this conversation of quality of life? So sleep is so important for so many things. It reduces stress, it strengthens the immune system, lowers blood pressure, improves appetite, increases mental clarity, and improves healing. And these are just to name a few. There are many more benefits of getting a good night's sleep. So specifically with cancer, researchers at the American Cancer Society did a study of over 1,900 cancer survivors from across the US. And these were people who had cancer about 9 years prior to this study. They were asked questions about their sleep and cancer history, overall physical, mental, and social health. And even though these people had been diagnosed with cancer almost a decade prior to this study, 51% reported their sleep had been disturbed over the past month. So it's a very significant issue. So what are some reasons that people might have sleep disturbance? So mainly emotional, psychological factors due to fears of recurrence, financial burdens after going through cancer, and family stressors. As a side note, I would also add pain to that list. If you've had different cancer treatments and surgeries, there are issues with chronic and lingering pain that might affect your sleep. So what are some treatment options? Obviously, there are medications. These might be over the counter or prescription, and you would need to speak to your doctor to find out if any of these are appropriate for you. And there's also something called cognitive behavioral therapy for insomnia, CBTI. And according to the Sleep Foundation, the American College of Physicians recommends that all adult patients suffering from insomnia receive CBTI as a first-line approach. So that should be the first thing that they do. And this treatment has been shown to be effective in groups at particularly high risk of experiencing insomnia. And I put in the bold, people experiencing insomnia after cancer treatment. Point being here, this is the Sleep Foundation and the American College of Physicians. They're not specifically looking at cancer survivors, but they have found that cancer survivors can experience significant issues of insomnia. And CBTI, cognitive behavioral therapy for insomnia, has been found to be a very good first-line approach for this. So what is CBTI? It's a multimodal intervention which can include or should include components of sleep restriction, which is limiting time in bed to consolidate sleep. In other words, you start off going into bed for less hours and try to get a good night's sleep there, and then you gradually increase your hours in bed. Stimulus control, which is not doing anything in bed that's incompatible with sleep. So not being on your iPhone, your tablet, your laptop, TV. The bed should be for sleep. And then cognitive restructuring, which is addressing maladaptive thoughts and beliefs about sleep to reestablish a regular sleep pattern. So that is trying to rethink your ideas of sleep, as well as many other tools that they have for this. I found one that was very interesting called cognitive shuffling. And what that is when you get into bed, you pick a word that you don't have any emotional attachment to. Let's say the word is cat. And then for each letter of cat, you start with C and you try to think of words that start with C, and you have to think of the word as well as picture what that is in your head. And when you run out of answers for C, you go on to A. The point being, you're taking the verbal as well as the visual parts of your brain and putting it to this exercise, which makes you stop thinking about the other things that maybe you're perseverating on. And it has been found to be really helpful to help people fall asleep. So I recommend you guys try that at home. And who provides CBTI? It's often provided by a doctor, counselor, therapist, or psychiatrist trained in it. And practitioners with experience in CBTI can be found in professional organizations like the Society of Behavioral Sleep Medicine and the American Board of Sleep Medicine. And of course, many online resources. And according to a 2016 study in the Sleep Medicine Review Journal that was done specifically with cancer survivors, CBTI resulted in improved sleep outcomes. These outcomes continued at 6-month follow-up, indicating they had long-term benefits. And this study supported a strong recommendation for the use of CBTI with cancer survivors. So now moving on to emotional and psychological wellness. So it's been very well documented that our psychological and mental health has a huge impact on our physical health. I don't think there's any question about this anymore. So what are some things that might be issues after you've finished your cancer treatment that can affect this? So, of course, the big one is fear of recurrence. Fear of the cancer coming back is very common in cancer survivors. And though you may go years without any sign of disease, cancer survivors say the thought of recurrence is always with them. You might worry that every ache or pain is a sign of your cancer recurring. Eventually, these fears will fade, though they may never go away completely. And you can cope with your fear by being honest with yourself about your feelings. Don't feel guilty about your feelings or ignore them in the hopes that they'll go away. And what are some things you can do to reduce those fears? Well, take care of your body. Diet and exercise makes you feel like you're more in control. Go to all your follow-up appointments. Get all your follow-up tests. Know that you're doing everything you need to be doing. Be open about your fears. Discuss them with your family or with a therapist. And if you can't do that, then at least keep a journal for yourself to record these feelings. And then stay busy. You should have activities that take your mind off your fears, as well as having a plan and a routine for every day to keep yourself active and busy. Other common mental health issues: depression, anxiety, post-traumatic stress. So you might have lingering feelings of sadness and anger. Anxiety, again, related to recurrence or other issues. I've heard many people talk about the term scanxiety, which is whenever you're going to be going for a scan or follow-up testing, you get a lot of things that come up with that. You might have stress just from daily life, things that maybe you weren't dealing with while you were going through your treatment, and now it comes back full blast, everything that you have to deal with in your regular day-to-day life. And then post-traumatic stress. It's a very real issue for cancer survivors. You might be unable to stop thinking about your cancer or the treatment that you had for it, or you might feel alone or separate from others. You might also have triggers that remind you about your cancer treatments, like certain smells or environments or going to a doctor's office, things like that, which can trigger anxiety and stress due to the cancer treatment that you had. Some other common issues could be issues with spirituality, just questioning, why did this happen to me? Or survivor guilt. Why did I survive and not somebody else? Maybe a friend or a family member that you know that didn't make it, or the person that you saw in your chemo treatments when you would go. So these are other issues that people are dealing with long term. And then finally, issues with body image, maybe due to surgeries that you had or effects of treatment like hair loss or weight gain, and issues with relationships, the toll that going through this might have had on your loved ones or your connections with them. So what can you do? There are lots of great support groups, peer groups out there where you can talk to other people that have been through similar things as you. We have social workers here at Lynn Cancer, as well as out in the public, that you can have one-on-one meetings with, sessions with, psychologists and psychiatrists, of course. Religious and spiritual leaders, if that helps you to speak to your pastor, your rabbi, any sort of community leader like that. Community resources, there's lots of things out there for the public. Online resources, again, you can find a lot of helpful information online. And then if you're fortunate to have family or friends that are there for you that you can talk to, that's always a great place to go. And now exercise. So this is a little bit more of my specialty. And I put in and activity because I don't want you to think that you just have to go out there and start doing some great form of exercise. Just increasing your activity level, as we'll talk about, is very beneficial. So exercise and activity. So exercise and cancer. There have been many observational studies that have shown reduced rates of certain cancers with exercise, reduced rates of cancer recurrence, reduced mortality rates, and reduced side effects of cancer treatment. So according to the American College of Sports Medicine, some of the benefits of exercise with a cancer diagnosis are it can help reduce fatigue, improve symptoms of depression and anxiety, improves sleep. So these are things that we just talked about in the other topics, which now we see exercise can help with too. Helps maintain or improve your ability to get things done in your life, improves your immune system, your appetite, your strength, range of motion, and your mental clarity. It can decrease your risk of lymphedema, and it can decrease your risk of cancer coming back, cancer recurrence. So how do I start? Exercise is planned activity to help you become more physically fit. But you can start by just being more active around your house, walking or gardening. The idea is to keep moving for longer periods of time. And then you might try a planned type of exercise to get stronger. So again, just starting being more active and less sedentary. So what are some, and how do I start? I'm sorry. You want to start slowly and build up slowly. You want to go at a comfortable speed that you can do while you're talking. Because if you get tired or out of breath easily, you might be discouraged and not want to continue. So it's okay. You might only be able to exercise for a few minutes before you slow down or take a break, and that's fine. Over time, you'll be able to walk farther or go longer without getting out of breath or tired. But if you push yourself too hard, you might have difficulty breathing, you might want to quit. So you need to start off being active at an effort level that you can handle. So what are some ideas for exercise? What can I do? You can go walking or running, biking, that can be stationary bike, or it can be biking out in the community, swimming or different aquatic exercise classes. Doesn't have to be that you're a great swimmer. You can get in the pool and do exercise or walking in the pool. Yoga, weight training and resistance training, dancing, sports, whatever sport that is for you, gardening, household chores. So I included that because I have a lot of people that tell me they love gardening, and that's great. I also surprisingly have a lot of people that like to do household chores. They love to clean their house. That can be a lot of exercise and very active. I don't get it. Not something I choose to do happily, but some people love doing it. And then, of course, a lot of online resources, again, videos and apps, and we're going to talk a little bit more about those later on. But there's a lot you can find online. And just to quickly mention, I mentioned resistance training or weight training. So these can take different forms. You can have light dumbbells at home. You can use cans of vegetables, water bottles. These are things that weigh about a pound. You can get resistance bands that are very inexpensive to do some of those exercises. And then there's body weight exercise, which could be doing squats or doing sit to stand from a chair. You could be doing push-ups on the countertop in your kitchen. You can be doing sit-ups, things like that, where you're using your own body weight as the resistance. And those are really good and effective too. So what does the American College of Sports Medicine recommend? So they put out a paper called Exercise is Medicine, and they have some specific guidelines for people with cancer. So first off, at the top, I want to go over, it quickly talks about some things, exercises that can help with the prevention of 7 common cancers. And These would be bladder, breast, colon, endometrial, esophageal, kidney, and stomach, where they found that if people did 300 minutes a week of moderate exercise or 75 to 150 minutes a week of vigorous exercise, it actually showed a reduction of these cancers with those patients. And then they also found that there was an improvement in survival rates for three common cancers: breast, colon, and prostate. They don't have the exact dosage yet for that, but overall, more activity led to better risk reduction of those. So overall, they say to avoid inactivity and improve your general health, you want to aim to achieve these current physical activity guidelines. And you can see, looking at here, they have specific amounts of what is recommended for aerobic exercise, for resistance exercise, and for a combination of aerobic and resistance. Don't get freaked out looking at all this. I know it's a lot of information, but we're going to go through it a little bit more in detail. So what you should know is when they talk about resistance training, they're talking about doing it twice a week, 2 sets of anywhere from 8 to 12 or 8 to 15 reps. So you do an exercise 8 to 15 times, you rest, and then you do it again. That's called 2 sets. And that is the type of resistance training that they're talking about. Let me go on to the next slide here. So this one is a little bit easier to see. So they say for overall health, for everybody, you want to aim to meet these current guidelines. So it's the moderate aerobic exercise, 150 to 300 minutes, vigorous, 75 to 150, plus resistance exercise twice a week. But then if you go down here, it shows specifically for people during and following cancer treatment that even lower amounts of exercise can help with the following cancer treatment-related symptoms: cancer-related fatigue, health-related quality of life, physical function, anxiety, depression, sleep, lymphedema, and bone health. And then if you keep going down, you can see that it says to improve these symptoms, you want to choose one of these plans. So in other words, all of this kind of exercise is great for everybody. But let's say you are struggling with, let's look at anxiety, which is the color red. If you look down at the bottom, you can see what types of exercise have been found to be beneficial for somebody suffering with anxiety after cancer treatment. Or if you look at lymphedema in blue, they have found that specifically resistance exercise has been found to be effective for them. Aerobic, maybe not so much for the lymphedema, but helpful with other things. So they have done these studies, and you can see what type of exercise plan would be best for your treatments, treatment-related symptoms. So we've talked a lot about moderate aerobic exercise, vigorous aerobic exercise, and you might be thinking, what does that even mean? Okay, so here's a way to sort of judge how you're feeling when you're exercising. So the intensity of your exercise can be measured using a metabolic equivalent of task, or a MET. So 1 MET is the rate of energy expended by a person sitting at rest. So myself and you guys sitting here right now, we're at pretty much a 1 MET. Light intensity activities is less than 3. Moderate is 3 to 6, and vigorous activities would be 6 or more METs. Sedentary behavior is described as energy expenditure of 1.5 or less METs. So examples of being sedentary is most office work, driving a car, sitting watching TV. So you're at a 1.5 or less. So that is considered sedentary behavior. Now the next one is called the rate of perceived exertion chart, or RPE. And this is a way that as you're exercising, you can kind of sense and feel where you're at. So you can see a 1 and a 2. A 1 is definitely like a 1 MET. You're not doing anything. A 2 to 3 or 4 is a light activity. When you get to 4, 5, 6, you're pretty much at a moderate intensity, so to speak. You're getting a little out of breath. You can still talk, but you're starting to sweat and get a little breathless. That would be a moderate. And when you get up to 7, maybe 8, 9, and 10, that is a more vigorous exercise. Obviously, they're exaggerating at the top when they say I am dead, but you're working at a level that you can't keep that sustained for too long. So I would say a vigorous should probably be more in the, 7, 8, 9 area. So as you're exercising, you can kind of get a sense of what intensity level you're at and where you want to be for that period of time that you're exercising. And again, 150 to 300 minutes per week of moderate. So that would be like 3 times a week, 30 to 60 minutes. And vigorous activity is 75 to 150 minutes per week. So if you want to shoot for doing aerobic exercise 2 to 3 times a week, resistance exercise twice a week, you'll be in a good spot. Okay, so to summarize, the American College of Sports Medicine Exercise Guidelines for Cancer Survivors recommends that all cancer survivors do at least, and this is what I just said, 30 minutes of moderate intensity aerobic exercise 3 times a week, resistance exercise 2 times a week, which should take you about 20 to 30 minutes, and overall avoid inactivity. Stay active and move. Dr. Catherine Schmitz is a very well-known leading researcher in exercise oncology. She's the author of a book called Moving Through Cancer. And this is a quote from her. "We need a paradigm shift, as we have had with exercise and heart disease. If we ask the average person on the street if exercise is good for the heart, they will say yes, but that was not always the case. At some point, there was a shift. We need an initiative to encourage a change in thinking with cancer survivors. A major effort should be geared toward increasing awareness of the importance of exercise among cancer patients, as well as providers and the general public." So if you can remember a time that if somebody had a heart condition, they were told not to do anything. You need to rest. You need to not exert, yourself. You need to not put a strain on your heart. And that's been really debunked. And now we have cardiac rehab programs, all over the place. And the idea of building up the strength of your cardiac muscles and working through it, and that is very recommended. So what she's saying is we need a change in that thought process when it comes to people going through cancer treatment, as well as survivors afterwards. Okay, so this next is a really, really great video. It's 20 minutes long. I'm just going to show you the first about, I don't know, 2 to 3 minutes, but I really encourage you to watch the rest of it. It's really inspirational and really full of a lot of good facts as well. So I'm going to play it. Hopefully you can all hear it and see it.
These dragon boat racers, pickleball, and soccer players, master swimmer, mountain climber, and I, an Olympic gold medalist, all have something in common: cancer. We're all survivors, not weekend warriors, not professional athletes, and we're actively moving through cancer. Surprisingly, only about 15% of cancer patients are told that exercise is medicine. That's a staggering small number, a fact that flies in the face of robust science. Hi, I'm Scott Hamilton, and for those of you who don't know me, I was blessed to be able to win 4 U.S. championships, 4 world championships, and an Olympic gold medal in ice skating. I also toured for 20 years and was blessed to be able to cover 9 Olympic Games for television. I'm also a cancer survivor and a 3-time brain tumor survivor. Here's what I've learned. A cancer journey is different for every single person that goes through it. But the one thing that we all share is you have to have strength, courage, a lot of laughter throughout it. I never want to give cancer anything it wants. In fact, I only want to give it what it doesn't like. And exercise is top of that list.
I thought that people who go to the gym was people that they didn't have anything else interesting to do.
20 years ago, Luz Pena learned that she had breast cancer. The advice she got from her doctor? Just rest.
Because the treatments were hard, they told me you just need to sleep and relax.
10 years later, Luz learned that she had ovarian cancer.
The recommendation now was exercise, be active, walk. That's going to be your best medicine.
The benefits of exercise in both treating and preventing cancer have been known since the 1970s, and recent studies have further established the link between physical activity and a lower risk of many cancers.
We have outstanding epidemiologic evidence that tells us that exercise causes about a 10 to 20% reduction in the onset of 7 different common cancers, including breast, colon, endometrial, bladder, kidney, esophageal, and stomach cancers.
Exercise oncology is a new frontier. Researchers throughout the world are adding insight into how much exercise is right for each patient and why it works.
Exercise. Okay, so I'm going to stop it there, but I definitely recommend continuing to watch it. And I love what Scott Hamilton says, which is, I never want to give cancer anything it wants or anything it doesn't want, and exercise is something it definitely doesn't want. So what are some online resources for you to look up? Some great websites and apps I found. Moving Through Cancer, which is what this video is from, Exercise is Medicine, tons of information. This is Living with Cancer, the official website there. Maple Tree Cancer Alliance. It has online exercise classes you can sign up for. You can work one-on-one. They also train exercise therapists out in the community. Live Strong is a program at the YMCA. They have it here in the one in Boca and in Boynton Beach, and it's an 8 or 12-week program. You do pay for it, and you have exercise classes with a trainer, and it's all people that are going through or have gone through cancer treatment. There's a couple of apps that you can get on your phone, the Cancer Exercise app and the Living with Cancer support. And these are great. Again, they have videos for you. They have ways that you can track your exercise and monitor it. Really great apps. And I think they're free. Maybe there's some paid part to it, but you can check those out. And then on YouTube, there's a lot of other ones, but Cancer Rehab PT, she has a lot of great informational videos, a lot of exercise videos. She also has a lot on lymphedema, but if that's not an issue for you, just look at some of the exercise videos that she has. These are just to name a few, and I'm going to put this slide up again at the end of the lecture, so if you want to write down any of these, you'll see them again and you can write them down. So just to finish up, just some amazing quotes that I found. First one, the actor Michael Douglas, "Cancer did not bring me to my knees, it brought me to my feet." Author Joseph Campbell, "You have to be willing to give up the life you planned and instead greet the life that is waiting for you." And Ralph Waldo Emerson, "What lies behind you and what lies in front of you pales in comparison to what lies inside of you." And I just want to say, first of all, thank you for listening, but there are so many things that were not in your control when you were going through your cancer treatments, and sometimes you might have felt powerless. But now moving forward, there are things that you can do to take your life back and get back to feeling like yourself and really be more in control. So that is the end of my lecture. I'm going to put up this slide for the resources in case anybody wants to write them down. And I guess I'll take any questions. I can't really see the chat on my screen, so if there are any, Janet, I guess you'll have to tell me
Yeah,
then.
I'm looking. I don't see any questions in the Q&A or in the chat box. But I do want to say that what you said in the beginning, that your presentation is really for all of us. I know it was aimed for, it's part of our survivorship series, and of course aimed for all of our community members that are cancer patients and cancer survivors. But really, this education it rang a bell with me, like to start exercising, as a means of prevention. So thank you. This was very informative. And as kind of a little side note on the exercise, I can do a little plug for our Run for the Ribbons. In February, on February 2nd, we have a run that is also a walk and can be 1 mile. The run or walking is 5K, which is 3 miles. And, but anyone can do 1 mile if that's a better start for them. And immediately following our run, we have a celebration for our cancer survivors where everyone can come inside. You must register first, but come inside and you can paint a tile. We have little continental breakfast for while you're painting, but we welcome everyone to think about that and give us a call if you're interested. And also, I know this was such good information that you may want to look at it again or share it with family and friends or someone that you feel will benefit from this education. And when Lee sends out the evaluation, usually it takes a couple of days to edit and get this presentation ready, but she can send you the link so you can share it or relook at it. So we appreciate you, Ruth. This was a lot of research and we appreciate all that went into it. It was excellent information for all of us and for everyone that took time out of their day to join us and to be educated. We really appreciate you. And we wish everyone a happy holiday season. And please join us in next year for our 2025 season of physician lectures, of nutrition lectures, and survivorship lectures. So thank you, everyone. And Ruth, you've gotten a few notes with great information, excellent presentation. Thank you so much. Very informative. So everyone agrees this was very, very informative.
Well, thank you so much for having me. I really enjoyed putting it together.
Good. Thank you, Ruth. We appreciate it as well.
Have a great day.
Goodbye, everyone.